Thanks for tuning in. This session is on mindful exposure to the large breath, one of the treatments that is part of the Mindfulness Based Anxiety Reduction program. And I'm going to just explain the 6 treatments very briefly. The mindful exposure to the large breath is deep breathing with a full expulsion. What relationship does that have to do with our anxiety? Well, we pay attention to the breath. That means that we are divesting from attending our anxious thoughts. What type of thoughts are those? Well, we come to learn what those thoughts are when we enter the meditation hall. When we sit quietly, we are visited by many different ideas and images and thoughts. And when we are emotionally wounded, some of those thoughts are our core disturbances. So these disturbances may include impressions of abandonment or impressions of being defective, impressions of abuse, impressions of emotional deprivation. So these ideas come across our minds when we're in the meditation hall, and what we do is we shift our attention from those ideas. So they are investments. Those ideas are investment. We invest our attention to them, and we have some type of outcome. So an investment has an outcome. Those outcomes are sometimes not favorable. They do not help us. They are our problem. So rather than in this approach, a mindfulness-based approach, we not only think to resolve our problems, reconstruct them, if you will, reconstruct our personal reality, we are also dismissing our emotional wounds. So now, is this a problem or is it not a problem? Well, the dismissal of it to shifting your attention to the breath lowers its value. In other words, when you begin to see a disturbance, you can begin worrying. Well, worrying is contingency planning and trying to fix the problem. We let that go, and we come to the breath. So you're devaluing the disturbance, and this is part of the healing process. There is an argument that can say, well, this is avoidant, and avoidance does not help. It is not. We are not in an avoidant coping mode when we decide to shift our attention away from our disturbances of abandonment, our disturbances of the sense that we are shameful, unlovable, defective in some way, the disturbances that our needs are not going to be met. We are concerned and anxious about these situations. We shift out of that. What we are doing is coming to the breath, devaluing those disturbances, and we are reconstructing personal reality. Why? The value system. Personal reality is constructed from a worldview, from a self-concept, from a value system, from knowledge, and of course memory. And we are changing values. Here we are valuing being present. And by the way, folks, this is a critical factor in mental health. That is the capacity to be present, the capacity to learn, to develop new schemata, rather than repeating old worries and returning to that dream again and again. So I hope that this brief conversation about shifting our attention from our conceptualizing to the breath helps you to get the idea of how we get better. In other words, knowing how a condition is treated gives us insight into the nature of our emotional wounds and the problems adjusted to that. So we want to know what they are, what the disturbance is. You can look at your history, sort of figure it out, or notice what you worry about, and you can determine what the disturbances are, what the theme is. And again, this insight is helpful. However, you need to use that insight by devaluing it. Get the idea? We need to bring proportion to our lives. Otherwise, our emotional wounds can run away with us, and they compete with our these values that come from our worry, compete with the value that forms from our personality, the natural interest and tendencies that we are born with, our inclinations, so to speak. They can truly abduct us from that for our whole lives. This is why contemplative strategies are important. I encourage everyone to begin meditation. You can utilize then mindfulness based anxiety reduction training in the meditation hall and throughout your day to begin to work on your self-conception, your worldview, your self-esteem, if you'd like to call it that, by this value adjustment. You are changing personal reality. Becoming present, coming to this moment is the work at hand. That is a very critical factor in mental health. Why? Because being present is what we are always in. We are always actually here. Best to come here. Okay, so we're going to move into the treatment where we'll discuss this same idea. When we look at the other treatments, we want to have mindful exposure to the present, which is the next step. We have then exposure to disturbances, exposure to some of our maladjusted coping modes, exposure to images of people. These images also are a similar process. We recall the images and we shift our attention from them. Where? Here. We come here. And what is here? Well, this is being present is you can be described as somewhat empty. Empty from what? Empty from a lot of conceptualizing. Very good for observation. By the way, the intellect is still operative. There is conceptual work being done. And what you're not allowing yourself to do, so to speak, or what you're shifting out of, is essentially ruminating. Ruminating is what is occurring. We are preoccupied, reinforcing our maladjusted coping modes, our worrisome coping modes, and we begin to shift out of that maladjusted coping modality to the adaptive coping modality of mindfulness. So I use the what was taught to me as the Misogi breathing technique. There are others. I use a full expulsion in mindfulness based anxiety reduction and a full inhalation. We inhale through the nose, keeping the body upright slowly, and then expel with an H sound, or positioning of the throat where it produces a kind of an H sound all the way out and getting all the air out of our stomach. We lift our back so the diaphragm can move. You can actually tip a little bit back and forth also if you'd like. So let's take a look at it, and wonderful exercise. I'm very grateful to Koichi Tohai and his teachers for having taught me this technique. I used it in the Zendo in my 20s. You may be aware that young people have a lot of difficulty with non-conceptual awareness. It's kind of uncomfortable, seems to get easier as you get older. However, deep breathing helps for us youngsters, or for youngsters that enter